The first question is really to talk a little bit about the Nuvisertib abstract, which I'm really excited about. Some lovely correlative cytokine or biomarker data. For this particular abstract, we utilize patient samples as part of the ongoing clinical study of Nuvisertib or TP3654 in patients with previously treated relapsed refractory myelofibrosis who had been exposed to previous JAK inhibitor therapy. So, as part of this clinical trial, we are collecting intermittent samples to be able to look at cytokines and how they change longitudinally in these patients with exposure to Nuvisertib, again, over the course of time. Really exciting data. And I think what makes it really interesting and impactful is the fact that there were so many cytokines evaluated and so many data points collected. And so what I think is really interesting and exciting about this data set is really just the size and the number and the volume of data points that are evaluated. And so we looked at clinical samples again in patients and were able to evaluate how cytokines changed both longitudinally over time. And we can see different cytokines that were consistently increased with exposure to Nuvisertib, and then another set of cytokines that were consistently decreased with exposure to Nuvisertib. And so that was really one interesting way to evaluate the data. The second way that we looked at this was to actually utilize a modified Kaplan-Meier analysis and to see how different cytokines were modulated over time over the course of the study. And again, we looked at this in the sense of seeing impacts on total symptom scores and how those changed in correlation or in relationship to these different cytokines, and then also to break it down further and to look at specific cytokines and how those changed in relation to specific symptoms that patients were experiencing as a part of this study. And so there were some interesting trends that pulled out. That data was presented, and we look forward to seeing that data mature as more patients are enrolled into the study and as we collect more data.